Per our house rules, this meeting is being recorded. To ensure the smooth course of our lecture, participants, other than the speakers, are muted to allow everyone to focus on the presentation. Participants are encouraged to actively participate by typing questions in the chat box during the Q&A portion. As we begin, may we start with a prayer, followed by the national anthem and the QMMC hymn.
Let's put ourselves in the holy presence of the Lord. Heavenly Father, please and thank you for this day, for giving us another opportunity to appreciate life and to fulfill our missions as your instrument. We humbly ask for your forgiveness for all our shortcomings. Help us to amend all our impieties, and may we learn to pattern our lives through your Son, Jesus Christ. Give us the strength to continue working for our kingdom, and may we become shining examples of your goodness and truth within wherever we are. Please bless all our endeavors, especially our event today. Inspire our thoughts, discussion, and ideas so that we may achieve our objectives to learn more about adolescent pregnancy. Continue to remind us that all that we do here today and all that we accomplish is for the pursuit of truth for the greater glory of you. This we ask in the most precious name of our Lord and Savior Jesus Christ. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, telas ng sinakanan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisigiw, sa nagagang tutok sa simoy at sa langit mong pagaw, ay hinagang tula, kawin sa pagkayang minamahal. Ang islang ng matawad mo'y tagumpay na nag-iibig, ang bituin at araw niya kailan pamay di magdidinig. Lupa ng araw ng walhaging pagsinta, mo'y langit sa piling mo. Aming ligaya na pagkay mga amin, ang mamatay ng dahil sa'yo.
Lingkod sa kapwa, ang pangunahing tungkulin. Mahusay na programa sa pangkalusugan at iba yung pagkalinga. Mayaman man o mahirap, ay paglilingkuran ng sapat. Anumang sakit o malubhang karamdaman ay bibigyan ng tiyak na lunas. Pilipinas. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC ang bayan ay paglilingkuran. Ito ang aming tanging layunin, mahusay at ligtas sa pagamutan, makabago at wastong kasangkapan, mga kawaning may sapat na kakayahan. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC ang bayan ay paglilingkuran. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC, sa QMMC, sa QMMC ang bayan ay paglilingkuran.
Our moderator for today had a residency training of Obstetrics and Gynecology here in Quirino Memorial Medical Center. She finished her subspecialty training in Pediatric and Adolescent Gynecology from Philippine Children's Medical Center and is currently a consultant and the section head of Pediatric and Adolescent Gynecology in QMMC. She's also a current member of the Adolescent Health Issues Ecological Society. Let us all welcome Dr. Angeline.
Okay, thank you, Chantal. Let me start by introducing to you our speaker for today. She finished her obstetrics and gynecology residency training in Quirino Memorial Medical Center and is currently a medical specialist 3 in our institution. She is also a consultant in minimally invasive and gynecologic surgery, the current vice president of the Philippine Society of Cosmetic and Aesthetic Gynecology, and is currently the head of clinical services at our department. Let us all welcome Dr. Melinda Rita L. Javier.
Good morning. I am Dr. Javier, and I'll be presenting on the insights, challenges, and interventions of teenage pregnancy. Teenage pregnancy is pregnant teens between ages 15 to 19, but it can also include girls as young as 10 years old. These underprivileged members of the community, they face social issues like poverty, poor health outcomes for both mother and baby, lower educational attainment, and employability, thereby causing economic losses to the country. And their future changes radically and rarely for the better. This is the outline of my discussion. Before I begin, there will be 2 occasions where we may field in questions from the audience. We will first entertain questions after the first 4 topics, namely the risk factors associated with adolescent pregnancy, social concerns or stigma surrounding adolescent pregnancy, the impact and the use of reproductive health education and resources for adolescents. And then we will again field questions after the last 3 topics have been completed. So the last 3 topics are support system for the pregnant teenagers, prevention for teenage pregnancy. We have to tackle programs and strategies in order to prevent this teenage pregnancy and opportunities or career opportunities that is presented to them after they deliver their babies. So feel free to write the questions down, or you may press the raise your hand icon to be acknowledged. According to UNICEF, in 2022, an estimated 13% of adolescent girls and young women give birth before age 18. And WHO in April 2024, most statistics show that every year, an estimated 21 million girls aged 15 to 19 in developing regions become pregnant. According to our local study, the Philippine Statistics Authority, in January 2023, there was a 35% increase from 2021 to 2022. So what are the causes and risk factors of adolescent pregnancy? In our institution, we started out with the HEADS HEADSS risk assessment evaluation in 2020 of patients, teenage pregnant patients who come to us admitted at the emergency room. H stands for home. So we need to ask them, who lives with you at home? Do you feel safe at home? Or are you still together with your parents? For the E, education, are you still in school or are you out of school? What's your favorite subject? So how do you get along with your teachers? For the activities, how do you spend time with your family? What sports are you into? What hobbies are you most likely involved in your activities? And for D, drugs, do you use drugs? Or how do you pay for your alcohol, cigarettes, or drugs? In what types of drugs do you usually use, or if at all, you're using one? For the sexuality, how long have you been sexually active? Or have you ever had sex with whom? Do you use contraceptives? Or are you even aware of the contraceptive methods in order to prevent pregnancy? Have you ever had sexually transmitted disease or infection? Or has anyone tried to force you into anything against your will, especially in favoring sexual acts? For the S, the next S is the suicide. Have you been having this suicidal tendency? Or did you ever try to hurt yourself? Or have you ever felt like hurting someone else? So with this, we need to know if they are danger to others or a danger to themselves. Most common causes of our teenage pregnancy for the last 13 months is presented here. Here you have a bar graph indicating the most common social demographic risk factors that were found according to our survey. So this is from July 23 to July 2024. So the prevalence was based on the number of patients with the most common characteristics shown over the total number of teenage pregnancy of 460 patients admitted at our emergency room. And here, our statistics show that we have an average of 35 admissions per month, with the youngest at 14 years old. But so far, from our census in 2020, we had the youngest at 11 years old. In summary, our patients are mostly first-time mothers, coming from a dysfunctional family, mostly living with parents who themselves are also young parents, so they don't have the strong role model to look up to. Most are enrolled in public schools as junior or senior high school. Take note that they belong to the low socioeconomic status and that half of them are alcoholic drinkers. When you're under the influence of alcohol, there is no logical thinking, and it increases the chances of unprotected and unsafe sex. And to date, third of them do smoke. But most relevant is that 80% of them lack the knowledge or awareness on the use of contraceptive methods because of inadequate sex education, and they lack access to birth control. Luckily, only 3 out of our 460 patients do drugs. So presenting to you our primary CS rate among all deliveries for the last 13 months, and it's been 1.67%, as compared to the 17%, which is our primary cesarean section rate for the last 13 months, including all teenage pregnancies. So it's quite high. So the most common cause or indication for our cesarean sections, number one is dystocia, because of the immaturity of their pelvis. Among teenage pregnancy, they don't have that mature component of their pelvis, so chances are they will have difficulty in delivering their babies. From 2020 to 2024, we only had 2 cases of mortality secondary to miliary TB with seizure disorder in an 18-year-old. And we had a 15-year-old with preterm intrauterine fetal death, consequently developed uterine atony and DIC. And take note, this patient never even had a single prenatal checkup. So according to a Philippine-based training and consulting firm, which is named nextstep.com, their study revealed that following causes of teenage pregnancy in the country are drugs and alcohol use. Of course, I already mentioned how you will have unsafe sex if you're under the influence of alcohol. They say most are for low socioeconomic status, just like our patients. Peer pressure, and sexual abuse. So mostly they have sex against their will, and they don't feel, and they don't tell their parents because of the feeling of being harmed by sexual partner. So usually we will have encountered patients who are also, they know they're perpetrators most of the time. So for fear of being harmed by them, they will just keep it to themselves. And the fourth one is inadequate sex education, lack of access to birth control, and increasing cohabitation. Now, child marriage, because of religion, has been a traditional practice in Islamic countries, putting them at higher risk for early pregnancy and maternal disability, and limiting their access to education and employment. So these 2 studies are consistent. So these mothers are then subject to hostile societal attitudes because teen mothers are stigmatized by stereotypes that they're unmotivated, irresponsible, and incompetent parents. The stigma surrounding young parents also stems from a shared social belief that young parents are inferior, unworthy of trust, support, or resources. And this further leads them to solitary, out of school, and they are then prone to poverty, unemployment, sexual abuse, sexually transmitted illnesses, and worse, mental health issues, leading to depression and even suicidal tendencies. Therefore, we should look into recommendations or programs restoring dignity and reducing stigma. This entails recognition practices that are based on respect and concern for the teen's well-being and their capacity as a first-time mother. And I will be discussing these recommendations with more details as we go along. We come now to the impact of adolescent pregnancy on the health and well-being of both the mother and the baby. Of course, it will result in health consequences. Based on universal statistics and the United Nations Population Fund, the risk of adverse maternal outcomes are related to anemia, preterm delivery, pregnancy-induced hypertension, dystocia, gestational diabetes, postpartum hemorrhage, and even maternal mortality. Since 2019, WHO estimated that among low to middle income countries, there are 21 million adolescent pregnancies each year, and 50% of these were unintended and results in estimated 12 million births. So among those 12 million births, these babies would suffer from low birth weight, intrauterine growth restriction, preterm birth, severe neonatal conditions, and even mortality. If pregnancy is unplanned and no proper prenatal care for both mother and baby, she may not even be healthy enough to carry a child. So specialized prenatal care with the general OB, or even if we deem it necessary to refer them to maternal fetal medicine specialists, they will be referred to them accordingly, because those late in prenatal care would most likely have these outcomes. If at all seen by our midwives or our doctors or generalists at the health centers or at your own clinics, it is very important to check for sexually transmitted infections added to the usual test. You may start them with folic acid containing prenatal vitamins and advise them regarding good nutrition, because most of them, they don't have sufficient calories, proteins, carbohydrates, vitamins, and minerals during this period. And it is very important for them to gain weight as expected. So we have the greatest challenges. We were able to interview 5 teenage pregnant patients who delivered in our institution. And here is a video that we would like you to watch.
Siguro po sa pag-alaga ng baby and sa pagbalik po sa school.
So gusto mo bumalik sa school?
Opo.
Pero sa tingin mo yun yung naging problem mo?
Opo.
Kasi?
Mas kailangan ko pong alagaan yung baby ko kaysa po sa pag-school.
Medyo nung una po kasi hindi ako agad nakapagpa-check up kasi po graduating student. Kaya po medyo late ko na pong napacheck up.
Kung kaya ko po ba na maging mother, lalo na nga po na buntis ako. Tapos yung mga sasabihin sa akin ng mga tao, like kesya gato ganyan na maaga na buntis, hindi nakapagtapos ng pag-aaral, lalo na sa college. Paano yung financial support sa family, lalo na sa baby.
Since 19 years old pa lang po ako and hindi rin naman po inaasahan na mabuntis ako sa ganitong edad. Marami pong sumasagi sa isip ko and disappointment na rin po kung paano ako makakabalik sa pag-aaral or maitataguhin yung anak ko. Pero sa tulong naman po ng mga magulang ko tsaka ng mapapangasawa ko po, parang gumagaan din po siya para maging maayos yung panganganak ko.
So as you can see, the greatest challenge, as you heard, is parenting problems, how to return to school, societal attitudes and stigma. But, somehow you can see that they're still optimistic when they know that the support systems are there to care for them so they could cope with awareness on this new role as a teen mother. So aside from these problems and challenges, this teenage pregnancy after delivery would have also vulnerability as a rapid repeat pregnancy. And rapid repeat pregnancy or recurrent teenage pregnancy is actually pregnancy within 18 months from the last childbirth. So in a thematic analysis, a study was done identifying what are the most likely causes of rapid repeat pregnancy. Rapid repeat pregnancy in Ghana, Africa. And it revealed that these are the multifactorial causes. Namely, they lack parental guidance and support because they are mostly treated as outcasts by their parents and the society. Next is poverty. Most of them would exchange sex for money to fend for themselves and their babies. Third is peer pressure. They say that if you are taking contraceptive pills or you are in long-term contraceptive method, chances are you will become barren. And they will say that you have to stop your contraceptive method because you will have a rare chance of having subsequent pregnancies. And so what do? They just stop it, and ergo, they will have another pregnancy after just within 18 months. When you talk about lack of information about safe sex, because of the challenges in the implementation of comprehensive sexual education, still we have the same problem as there is in Ghana, Africa. And those who cohabited with their partners, they have a 16% greater chance of having recurrent pregnancy, and that they are twice more likely to experience depression that can negatively impact the child's development. So that what I'm trying to say is that postpartum depression is also a problem after teenage pregnancy. Chances are, in studies, there is suicidal ideation in 3%. And these are symptoms of anxiety and depressive disorders. And in one systematic review, there is 7 to 37% prevalence during the 3 months postpartum. Having said all these consequences, we then need programs to include interventions that provide reproductive health education. They should have access to reproductive health education, and I firmly believe that the cornerstone of prevention in teenage pregnancy in the Philippines is reproductive sexual education. Comprehensive sexual education is when they are given information on cognitive, emotional, physical, and social aspects of gender, sexuality, and adolescent reproductive health, like the use of effective contraceptions such as progestin subdermal implant in our institution. We usually give them PSIs that would last for 3 years, and this will be replaced again with another after 3 years. So pwede pong sabay yung insertion and yung replacement at the same time. They just have to come under scheduled insertion and reinsertion and removal. We also give them long-term contraceptive method like IUDs. And we have to inform them that delaying sexual activity in young teens will be very, very effective. Furthermore, we empower them to realize their own well-being and dignity, to develop respectful social and sexual relationships. Teenage pregnancy reduces educational attainment and hinder academic goals and achievement because of the high rate of school dropout. They will not graduate from high school, let alone get a college education. Some will just accept low-paying jobs, or worse, there is unemployment and eventually leading to intergenerational poverty. Most of our patients have no resources as they come from low-income group, and consequently, they have to delay their future plans, and therefore, they do not develop their self-identity. So we can see here that the percentage of teenage pregnancy decreases as educational attainment increases. And it is 5.3% among those who reach level grades 7 to 10, 4.8% for those completed 11 to 12, and just 1.9% for those who attained college level. So, in the implementation of reproductive health education in a Filipino city, this was a case study from International Journal of Educational Development. And this answers the question of how reproductive health education is implemented in Filipino schools, where it is not readily accepted even after the implementation of reproductive health law in 2012. The summary of research findings denotes that according to non-compliance category, the number one is that they have different definitions in the reproductive health competencies. Say, the revised reproductive health content in K-12 starts from grade 5 learning. They have to learn physical changes in puberty. So it will start like grade 5, and that is around 9 years old or before puberty. And then these reproductive health contents, such as pregnancy and sexual relationship, are much delayed. They are much more delayed. They are usually taught in grade 8 student. But there is no detailed lesson plan or curriculum representing this sexual health education. Most of the teachers also, they lack knowledge and method of teaching, and they would modify it to avoid conflicts in the community, especially when using the right terms, like how will you define masturbation? What about private terms terminology such as penis or vagina? So some topics will be considered even as taboo. So these topics should not be discussed with them. So they would rather skip this part of teaching. Also, the concept of reproductive health as is a family responsibility rather than schools. So it is discussed rarely, and it remains a myth or stigma or enigma for them. Siyempre, kung hindi nini-discuss at home, and even at school, this teenage population, they will have no perception of what sexuality is all about. And this would lead to exploring different ways with love and intimacy. Chances are they will try it with their peer partners, and these will be followed by unprotected sex and then teenage pregnancy. Flashed before you is a copy of the policy guidelines on the K-12 implementation of comprehensive sexuality education in the K-12 curriculum. So it should be started at around 8 years old. That is, the teaching and learning evaluation is set 1 to 2 years before the development milestone, namely puberty and early adolescence, middle adolescence, late adolescence until the early adulthood. But yet again, there is no concrete curriculum at all. I just don't know with some private schools, maybe they have, but they say in public schools, they are totally not learning about comprehensive sexual education. So it was established in K-12, in the year 2012, rather, for K-12. Until now, wala pa rin hong tamang curriculum or lesson plan for this sexual education. Yung last reason is that the Department of Education is actually passive on this topic. They claim also that Department of Health does not provide proper funding, and so they are mostly dependent on non-government organizations to help them, but still there is lack of reproductive health teaching personnel, lack of venues. At kung meron man pong venue, this is not a comfortable place to have proper interaction with this age group. But you know, from analyzing these findings, we should be able to learn from them and be able to improve our reproductive health systems. From this point, we are entertaining questions. Before I proceed with the next half of our discussion,
I'd like to invite Dr. Javier and Dr. Santos for our first set of question and answer portion.
Good morning, everyone. Video ko. Okay, thank you, ma'am. So again, that was just the first part of our lecture. But at this point, we would like to answer 2 questions that were privately sent to me. To our participants, please don't be shy. Just type your questions in the chat box so we can address them. Okay. So, ma'am, for the first question po that was sent to me, what are the steps our institution is taking to decrease the stigma on teen preg patients who want to get checkups but are ashamed?
Okay. So the stigma we have to deal with. Meaning we have when it comes to our institution, after delivery we have to boost their morale. Let them realize that it's not the end of the world. Not the end of the world. So pwede nilang masabi sa sarili nila na um, doors are closing, opportunities are lost, but then we have to make them realize na there's more to it. It's not impossible to live their life as they want it, even before their teenage pregnancy. They can live their life the way they want it, and there's more to just being a teenage mom. So, of course, we're also setting up clinics for them so that we will have to let them um, have self-empowerment. Kasama na po yun if we want to establish particular clinic for them. There will be a certain clinic that this will be catered only to adolescents, non-pregnant and pregnant patients. And of course, aside from that, kailangan we have to treat them with utmost respect. Yung mga residents, sinasabihan po namin na to be magalang to them, kahit na po bata sila, we have to respect them, we have to secure their privacy, we also have to involve the parents para naintindihan po nila. So I think that's it, Dr. Santos. Also, no, let me just add, lagi na po kami nagbibigay ng lectures every last Wednesday of the month. We give lectures regarding labor, what they have to expect during labor, what about their choices for family planning afterwards, and what are their, kung saan po namin sila pwedeng i-refer. So proper referrals are done even before they deliver the.
Yeah. Okay. Thank you, ma'am. I just like to remind also everyone na the approach for teenagers is really different kasi pag na-feel nila na they're not parang they're judged, they can be rebellious. So I think we'd rather have a teen pregnant patient rather than a complicated teen pregnant just because na-discourage sila magpa-check up because of the attitude ng healthcare workers. Okay? And then, sige ma'am, for the next question, if one of the problems stems from the lack of access to contraception and the lack of a comprehensive reproductive health education curriculum, which is beyond our control po, what as health workers can we do?
Of course, sinabi ko na ang cornerstone talaga ng control or mitigation of teenage pregnancies, reproductive health, or comprehensive sexual education. Kailangan po natin to strengthen yung curriculum. We will start somewhere. Hindi ho pwedeng hindi natin ito ita-tackle. So with that, yung reproductive sexual education, educate po natin sila scientifically. Kailangan malaman nila what is it all about. We can start naman early on with just discussing the scientific reproductive organs, how the usual how mating is could produce baby, especially kung unsafe sex or if they are in the influence of alcohol. So, i-educate po natin sila. We have to strengthen that thing. Yun talaga yung cornerstone. And of course, under construction na rin po yung aming clinic. Sinabi ko nga that they will have to come to us and then multidisciplinary po ito. So as health workers, mag-establish nga po kami. We have everything there. Family medicine, ultrasound, i-refer po namin sila kung pati sa social worker, pati po sa vows. At I will expound on it later. So Furthermore, kailangan talaga involve natin ang parents. Kasi nga po, kailangan ng uh, ng proper guidance. We have to educate also the parents, involve them. Kasi sila yung first hand na information ng mga bata. So, just continue with our advocacy. And I think we will be in the right path. That's all.
Thank you, ma'am. Actually, naisip ko nga din po, ma'am, maybe as health workers, we can start din po at home. Parang if we have kids or yung mga teenagers natin, we can also start by talking to them. Kasi we all know naman na yung information, they get it from their peers. So kung at least tama yung information na share natin to our kids, tama yung share nila din sa classmates nila. Di ba, ma'am? Okay. We have a question po here in the chat box. Considering that teenage pregnancy affect the education of these people, what is the strategy or approach of the DepEd in order to prioritize this issue? Ma'am.
Okay. Hindi ko pa na-discuss, but later on I will discuss, no? But just to give you a gist on this information, we have in Quezon City Health Department, meron po na youth center, and then they can go there. Pag nandun po sila, depende po kung ano ang needs, kung ano ang kanilang dahil ko nga po, sabi ko, pagdating po nila, health evaluation tool pa rin ang gagawin natin para malaman natin kung saan natin sila ipa-proper channel. So pagdating po nila, kung dito man po sila magpapatingin sa Quirino, meron na po kaming mga protocol na in place na po yan. So pagdating po nila, pwede pong sa outpatient, pero kailangan po talaga ng guidance ng mother, any of the parents, or yung pong legal guardian niya. Kung siya naman po ay biktima ng rape or molestation, pwedeng didiretso po kasi yan sa hospital, or rather sa police. So pag police po, they will channel them to I think Camp Crame. Isa po kami sa mga referral centers. So pagdating po nila sa amin, VAUSI naman po yan, i-refer po namin, and then accordingly, i-analyze sila sa iba-ibang kailangan nilang puntahan.
Okay. I will have another question. I think this is a very important question too, ma'am. Is there any legal liabilities if we health workers give contraceptives to adolescents?
Legally, is that legal liability ng doctors, right? Legal liability ng doctors? Or ng parents? Ng doctors, right? Alam niyo po, Catholic po tayo eh. Hindi po talaga pwede na hindi tayo magbibigay ng consent of the parents. Kailangan po may consent. So pag hindi po natin yan binigyan, pag nagbigay po tayo, may legal liability po tayo. I believe so.
Yes, ma'am. Bawal po tayong magbigay to the adolescents if walang parental consent. So, the parents also have to be around and counseled pag magbibigay tayo ng contraceptives. Di siya bawal sa adolescents, but we need consent po. Maybe I can just take one more question before the second part, as we can address the other questions after. So, last question, ma'am, for this part is teenage pregnancy daw po ba can be are teenage pregnant patients prone to having cervical cancer?
Cervical cancer po, ang cause nito, pwedeng early contact or yung promiscuous po sila, marami po silang sexual partners because the virus is there and we get it from our sexual partners. And then, depende na po yan sa dami ng partners ng ating sexual teenage adolescent or adolescent. Pero, kaya nga po, it's very important and emphasize ko na kailangan po ng screening for sexually transmitted infections such as HIV, hepatitis B, syphilis. Marami na po kami nakikita mga cases na yan ngayon na we used to not see them or encounter them. But now, siguro nga sa dami ng sexual partners, pwede po talaga sila maging high risk or yung maging victim ng cervical cancer kung marami po silang sexual favors, lalo na po kung, syempre, kung medyo hirap, some of them will just, get money in favor of sexual, sexual act. So, may risk rin po sila.
Thank you, ma'am. So I guess we will just proceed to our second part and then answer the rest of the questions later.
So I'm back. So to continue on with the second part of my lecture, now we will be talking about the support systems for teenagers, including family, friends, and community organizations. Family support begins with constant communication at home. Abstinence or promoting abstinence is the safest way for them to absolutely no incidents of teenage pregnancy. Second, research shows that when you set rules and monitoring at home of what they watch on TV, the music they buy, and especially the internet community they access, there is less likelihood for them to engage in premarital sex. So you also teach them modesty. Also, when dressing up, you have to set as an example. They should be discouraged in the early use of makeup and jewelry because this will make them more mature looking. And, most of the time they will be complimented as to their character traits rather than, they will be complimented as to their physical attractiveness rather than their character traits. So, set as an example, lalo na po yung mga mothers. So, don't let them dress up revealing clothes. So, and research shows nga na you have to control what they're accessing online. You spend more time also with them. Or if you want to go on vacation, you may want to go with friends or families who share the same values as you are. Fourth, you also have to discuss sex issues. Well, sex issues should be appropriate naman po. You may start conversations. You may initiate conversation like, how are you today? Do you have like attractiveness or are you attracted to someone? Listening, talking and answering in a non-judgmental manner will be very effective for them. You also, of course, you protect them from pornography, sexting, sharing photos of sexual acts, and especially from those sexually explicit media. I don't know if you remember, meron pong mga bata na nag-boyfriend online, then they meet, nag-eyeball to eyeball daw, and then, next thing leads to another. The little girl, she doesn't know na there is recording ongoing. So she will be exploited later on. Sasabihin sa kanya, if you don't give me this much amount, I will upload it on the internet. So the poor girl, with all those problems, pwedeng to the point of hindi siya makapagsabi sa parents niya, and then yung predator naman is still pursuing her, and then it will come to a point na wala na siyang matatakbuhan. And it can also then lead to suicide. Alam niyo po, may mga ganong instances. I'm sure you're well aware of this. You know, you should also spend time with them. Because teens may appear grown up, but still they lack the adult mental and emotional maturity. Because po yung prefrontal cortex, or that part of the brain that helps a person manage her impulses, to regulate her emotions and forego pleasure, it is not in full maturity yet until she is about age 25. So my point is, you have to guide them until 24 or 25 years old. Next is also to maintain a healthy marriage. Nagiging example po tayo ng mga anak natin. If you are within a healthy marriage, chances are you will be their role model and they will follow your lead. They will also look for partners who themselves are most likely that of the father or the mother. The next one is to set rules for dating. Huwag niyo pong hayaan na yung anak niyo maiwan with the partner nang solo po sila. You have to be a chaperone. You have to go with them, especially when they are dating. Yan na yan po ang kailangan niyong gawin. Or at least, you have to monitor where they are at this particular time. And you have to give them a curfew hour talaga po. And you have to strict with the rules. You have to be strict with the rules. So, like what I said, these are strong family support that we can start at home. Comprehensive sexual education integration in K-12 with proper curriculum has not been a has been a long delay program in the implementation of reproductive health of 2012. And therefore, it is a significant missed opportunity to provide them with choices and life skills needed to make well-informed decisions as to the risk and the consequences to their health. But contrary to popular belief, there is no evidence that shows na pag binigyan niyo po sila ng early comprehensive sexual education, that this would lead to early sexual debut or increased sexual activity. You just have to give them the proper methods and proper use of contraceptive devices that will be relevant to them depending on their needs, and you have to give them information on what the various forms are available for them. Also, the parents can strongly influence by taking time to be involved with that issue. Especially po, kailangan po nating maging relevant sa kanila yung consequences of unsafe sex. Of course, the consequences there is them getting pregnant. Aside from that, schools must also provide information on the prevention and responsible choices. So it's both the school, the family, community, government organizations. So all levels of our government have the responsibility to ensure that adolescent and youth populations enjoy the highest attainable support. We are all aware of Executive Order 141, and this was issued on June 25, 2021 by then President Rodrigo Roa Duterte. It is entitled Adopting as a National Priority the Implementation of Measures to Address the Root Causes of the Rising Number of Teenage Pregnancies and mobilizing government agencies for the purpose. So the focus of this executive order should be on transformative intervention, especially their rights to health and development. Henceforth, Quezon City Ordinance Special Order number 3128 was installed or was instituted and have installed various projects to execute this with the creation of the following. This is the prevention programs to address the increasing adolescent pregnancy within the territorial jurisdiction of Quezon City and providing funds thereof. Other declaration of policy is to pursue an adolescent pregnancy reduction strategy that is anchored on the development of adolescent and their rights, provide safe, quality, and respectful maternal health care, including antenatal delivery and postnatal care, to encourage and enable adolescent mothers and fathers to continue and finish their education in order to equip them for a better life. Aside from that, the Quezon City Youth Development Council was instituted, and this council is composed of representatives of young and youth-serving organizations in the provincial, city, and municipal level, with the primary function of assisting in the planning and execution of projects and programs together with the Sangguniang Kabataan and the Federasyon ng Sangguniang Kabataan in all levels. So you see, the support system would also involve their same age group. And in Quezon City, the Quezon City Adolescent Pregnancy Prevention Council, or QC APPC, will serve as the implementing body of all the programs from the Quezon City Health Department. Access to family planning methods in all minors there should be information and services to these methods with the consent of their parents or guardians. And after counseling, it is carried out with the end in view of ensuring healthy practices, especially those in vulnerable circumstances, from possibly predatory and sexually exploitative practices. So all the health services providers are there. Available po ito sa Quezon City Health Department. Kung meron pong kailangan paghiwalayin na victim and perpetrators, i-refer po natin sila sa proper channels. Now, maternal and neonatal care services or reproductive health services are given in a non-discriminatory and with confidentiality without the fear of stigmatization, discrimination, and violence. All services sa ating pong institution are provided and funded by our Gender and Development Fund. Ito po yung tinatawag naming GAD sa institution namin. And these examples of support systems are those that operate within Quezon City po. And luckily, we are one of the medical centers that coordinate with them. The next topic is prevention. This is so relevant that I hope this would lead us on the right path in the establishment of our teenage pregnancy clinic. Yes, you heard it right. We are coming up with a specialized clinic to obstetric and gynecological services for adolescent pregnant and non-pregnant female patients to be called CAMPI. Ito po ay Quirino Adolescent and Maternal Pregnancy Clinic. Yun po yung acronym ng aming soon-to-be constructed na clinic. Our aim is to come up with the programs and strategies like comprehensive counseling and psychosocial support so that it will be a multidisciplinary clinic. So aside from our OB specialties, there will be adolescent gynecologists, adolescent medicine, pediatricians, neuropsychiatrists, also involving our ultrasound section, our family planning clinic, and also our VAUSI or Violence Against Women and Children section. Our goal is to somehow help them find their resolve so we could help them in eliminating this teenage pregnancy. So here is, in January 2020, a survey was done, or a study was done by United Nations funding to tell us how it should be done when eliminating teenage pregnancy in the Philippines. This is a figure or the pie graph that shows recommendations from them. Sabi po nila, number 1 is increasing resilience and protection in order to make healthy, responsible decisions. Young people, they need accurate information about puberty, reproduction, relationships, sexuality. They should know about the consequences of unsafe sex and sexually transmitted infections like HIV, hepatitis B, and the consequences of unintended pregnancy. So, kagaya na sinabi ko sa inyo kanina, we should be able to order sexually transmitted infection panel together with the most common laboratory or diagnostics na in-order po natin. Sabi, the second is better fertility rates management. They say that we have to institute health reforms to improve employment opportunities to young people by discouraging early marriage and pregnancy. Kasi kung mostly involved po sila with work, no? Hindi po nila maiisip to have romantic relationships, and most of them would end up marrying a little later pa, so that they will be well prepared in starting their families. Third is enhancing social protections. Kagaya po nung ating Quezon City, APPC, and the Prevention Council na ipinakita ko na po sa inyo. So this is an ongoing project for the Quezon City Health Department. There should also be an adolescent and youth-friendly services, which is an arm of the Prevention Council. Kagaya po nung sinabi ko rin kanina, this is in collaboration with Sangguniang Kabataan. Here, they should have a welcoming and respectful environment with appropriately trained responders to their needs. And it should be a non-discriminatory, helping, and confidential manner. So the study suggests that the roadblock requiring parental consent for teenagers to be dispensed with, yun po ang gusto nilang isa. Pero alam niyo na po, with the Catholic country that we are, I know even with an optimistic view, like for late teens at 17 to 19 years old, that legal principle isn't going to change anytime soon. Unless Congress could one day make medical exceptions to this rule. Otherwise, it's the law. We still need parental or guardian consent for them. Sa amin ho, basta less than 19 years old, parental or guardian consent are still necessary. Hindi po natin sila pwedeng bigyan ng any form of contraceptive method nang wala pong consent with the parents or the guardian. And then sabi nila, strengthening parental skills for adolescent and youth play an important role as health educators with important influence on young people's attitudes and behaviors. Tama po yun. That means we need to involve the parents if we are to start our CAMPI Teenage Pregnancy Clinic in our institution. Hopefully po, malapit na po ito. Another prevention strategy is in strengthening interagency coordinations and collaborations. Those adolescents who have already become parents, they need to be provided with access to quality social welfare services. Kagaya po nung postpartum family planning support, kailangan po ma-lecturean natin sila on the proper spacing of pregnancy and really delay the next birth. Kung pwede, 10 years after for these teenage pregnant women. That's why we give them IUD. What about case management interventions? These case managers are particularly those of the young parents who are assessed to be a child in need of special protection. They will be referred to social workers, DSWD, barangay officials, VAUSI, and even the public attorney's office. Kasi po, yung perpetrator, kung kasama pa po niya yung victim, chances are, natatakot yung bata, and then pwede po ulit siyang mabuntis. So, kung ang perpetrator, kasama pa niya, the trauma is still there. So, kailangan po, i-refer natin sila sa VAUSI, and kung kailangan sa private attorney's office, kailangan po ng kasuhan kung sino man ang perpetrator. We also have to link them to resources advocating high school graduation. Pwede pong magbigay ng tutorial services for them or internet yung at home lang. So eventually, pwede silang graduate with a high school diploma. And later on, mag-enroll na po sila for college. So what about social protection to reduce vulnerability? Well, still, ito po yung healthcare assistance na encompassed then by our sexual health education and yung pong mga corresponding agencies na nandiyan po sa health center or nasa Quezon City Health Department. Another one is adolescent sexual and reproductive health. Parang pareho na rin po yun eh. Basta reproductive health, reproductive sexual health, kailangan po nila yon. And the last one is information and service delivery network. So it is a health and social systems with training on social care. So these are all the things that we have to remember so that we will advocate policies and lead them to the proper path. What about the use of media communications? It is also a vital part as this provides an opportunity to implement programs directed at young people to harness the potential of these online platforms. This media communication, they will serve as avenues to promote positive self-image, responsible sexuality, and help-seeking behavior. Lastly, there should be a robust data and statistics and more updated evidence and policies or programs for adolescents. It should have a sound policy formulation, effective implementation. There's also monitoring and coordination hinged on the availability of quality data. So, i-mention ko lang po ulit yung aming campaign, Quirino Adolescent and Maternal Pregnancy Clinic. And this is our objectives. We want to reduce or control the incidence of teenage pregnancy cases in our institution, o kung pwede po yung catchment areas namin as far as Kamanava and even nearby provinces. We also want to increase basic knowledge in safe sex and reproductive health of teenage mothers in the clinic. Third, we want to prevent rapid repeat pregnancy, to provide comprehensive counseling and psychosocial support among teenage pregnant patients, and deliver them in our institution and help them find their resolve. And also to establish a program that specializes in addressing the needs of teenage mothers, especially in family planning means. And also in collaboration with the pediatrics. Kasi after po ng pregnancy nila, usually mga 6 to 8 weeks, kung wala naman pong further problem, we will refer them to the pediatrician who will be in charge of them. Okay, now we come to the last part of my talk, which is education and career, or their access to career opportunities. According to youth.gov, school-based interventions will be helpful for them to be effective in likelihood of completing high school, which is as follows. Vocational training, teaching them vocational courses. We can also involve them in TESDA, if that is possible. Alternative schooling at home, so they will be able to finish their grade 12 studies and then eventually having a high school diploma and enrolling in college education. Social emotional skills training is also of utmost importance. College-oriented programming will also be very helpful. Sometimes you can invite those college students to come over and then teach them or initiate what programs that they would most likely be involved in for their future plans, and also mentoring and counseling. So addressing this through social work interventions and focusing and promoting healthy and responsible parenthood, we hope that they will have improved career opportunities later on. But to tell you frankly, their career opportunities will really depend on their social condition. For those poorer patients or those who belong to poorer families, of course, I would say mas less po ang chances nila kasi most of them baka hindi po makatapos ng high school because they have to earn more to be able to support their child. And then those belonging naman po to higher economic strata, of course, they have a well-structured support group. Meron pa ho minsan, pwedeng maging mother na nung bata, yung mother ng pasyente. So much so na hindi na po na-identify later on pag lumaki na po yung bata na akala niya ang mother niya is actually her sister, pero in reality, akala niya ang mother niya is not really the mother, is supposed to be her grandmother. Pero marami hong cases na nagiging yung siblings, akala niya sibling niya, but in reality, it's her mother. So, these are instances na depending po sa socioeconomic status ng patients. All right, so these are the harsh realities that we have to accept. So, given how prevalent teenage pregnancy is in the Philippines, especially with our underprivileged youth, it is my firm opinion that we should keep this day to our hearts as a basic act of support and solidarity. So let's celebrate the national campaign to prevent teen and unplanned pregnancy every year on the first Wednesday of May. And this has been going on since year 2002. So, eventually, magsa-celebrate na po kami nito sa aming teenage pregnancy clinic. And I would like to end my talk by quoting Miss Jane Fonda. And she said, if we as a nation are to break the cycle of poverty, crime, and the growing underclass of young people ill-equipped to be productive citizens, we need to not only implement effective programs to prevent teen pregnancy, but we must also help those who have already given birth so that they become effective, nurturing, and bonding parents. And these are my sources. Thank you, everyone, and have a good day.
Again, we would like to invite Dr. Javier and Dr. Santos to answer your second set of questions for today.
Okay, I would just like to read some of the other comments from the chat box. From the Clara de Vera, maybe healthcare institutions can allot a hotline for teen pregnant patients where they can easily contact us for concerns considering their need for utmost privacy and confidentiality.
Oh, yes. Yeah. Oh, yes. We will be coming up with that plan. So, in the bag na po yan. Just give us a chance to establish. Yung kinokontact pa lang po kasi yung company namin. So, we will announce it.
And another comment, ma'am, is emphasizing po na the difficulty for our teen patients kasi they have difficulty getting contraceptives since the parents are not open to giving consent. It is that's one of our main problems po. But that's the challenge for us health workers, especially yung mga health workers who are dealing with this age group. Okay, please type any more questions, and I have one more question po, which was sent privately. So if you're shy to type sa chat box, just send me a private message. Ma'am, the question is, are we not encouraging or spoiling these young teens by setting up an adolescent pregnancy clinic? Or baka ma-encourage po sila na mabuntis. Yun lang.
For me, not at all. It is not encouraging. It's not easily encouraged because we have to embrace this changing generation. We have to accept it. This generation, they know about sexuality, they know about sexual behavior, and they start young. So, but then again, sabi ko nga, you have to guide them. As long as you have guidance from family to the government, to non-government institutions, especially in Quezon City Health Department natin, marami tayong support group. Nandiyan na ho yan eh. It is this generation. We just have to guide them, especially the proper use po ng contraceptive method. You have to emphasize yung what are the risk factors na makukuha nila once they get pregnant. Yung pinakamasamang pwede natin sabihin sa kanila is, masisira ang buhay mo if you get pregnant in your teenage years. Mawawala lahat ng dreams. So, but then, sinabi ko nga kanina, nandiyan na yan. Kung nandiyan na yan, then we will support them. Pero hindi ho ito encouraging. At nandiyan naman ho ang legal consent ng parents. Kahit to parents ngayon, I think, lahat po tayo as parents, alam na natin it's their generation. So, just supporting them will be the most that we can do.
I agree po, ma'am. And also a comment from Dr. De Vera also. This Campi Clinic can serve as a venue to properly educate teenagers. Yes, that is our goal po. And ma'am, my last two questions po. One is how to improve our pregnancy tracking. Baka in our institution, siguro, ma'am.
Tracking of our teenage pregnancy. Ano po yun eh? We have a protocol na in place, like what I said. After po ng delivery nila, pupunta po rin sila sa aming clinic. Kung kahit naman po wala pa yung Campi Clinic namin, they can come over for postpartum monitoring po. Ngayon, sabi ko nga, kung after 6 to 8 weeks, wala naman po silang concerns. Kagaya minsan with postpartum depression, teka muna, parang matagal na yung restlessness niya, matagal na yung anxiety niya. It should only last like for hanggang mga 5 days lang eh. Pag halimbawa, medyo tumatagal na yon more than 2 weeks, kailangan na po natin silang i-refer. Pwede pong sa psychiatrist or psychosocial support. Hindi naman necessary na i-red flag na natin sila na may mental illness. Normal din po na talagang magkaroon ng postpartum depression. Kaya lang yung matagal na, hindi na po yung normal. So, ibig sabihin, kung nakikita natin na may ganung problem, pwede na pong i-refer sa psychiatrist for medication. Kasi pag hindi po sila nabigyan ng gamot, lalala po yun. And it will linger. And mahirap na rin po mag-alaga nung babies nila. So, yun, one of our monitoring. Pag na-set up na po talaga yung clinic namin, it will be very, very useful for all of us. Ito po yung advocacy namin sa department. Believe us when we say we really want to help. So, i-announce na lang po namin yun. Basta i-monitor namin sila, nandyan lang po yan. Ngayon po, kahit wala po yung clinic, minomonitor po namin sila at nare-refer po sila bago po sila manganak, meron din po silang chance na magkaroon na ng consultation with adolescent medicine. Yung po adolescent medicine, yung po ay pediatrician. So lahat po ng concept on sexuality, sexual behavior, lahat po ng even sexual desires, lahat po yun, sino-cover na po yun ng adolescent medicine. So even before, bibigyan na rin sila ng, bago sila manganak, lahat ng expectations, binibigay na po namin yan sa kanila. And then, monitor namin sila. Kung hindi na po, okay na po sila after 6 to 8 weeks pag-anak, sa ano na po sila? Pedyo na po sila. So, continue pa sa monitoring.
Okay. Meron pa pong mga pahabol na question na. Eto. Makakatulong po ba na ibalik ang curfew sa mga kabataan?
What is it?
Curfew daw po, ma'am. Will it help reduce the, yung...
I think so. Curfew? When we talk of curfew, mga, oras ba yun? 10? Is that 10? 10 p.m. I think it will contribute significantly kung magkakaroon ng sa kabataan, yung curfew na yun. Kasi syempre, the less time we are together or making gimmicks, mas less din ang chance na magkaroon ng intimacy, and then, pero kung importante talaga po reproductive sexual health eh. Kahit naman bigyan mo yan ng curfew, they can stay together, di ba? Wala namang makakapigil sa kanila. Pero if we prevent it, then walang magiging consequence. They will live their life as they envision it to.
Agree din ako dyan. Okay. We have one last question na lang po in the interest of time. Regarding pornography naman, ma'am, since it is readily available daw po and one of the causes of teen pregnancy because di naman mababantayan ng parents 24/7 yung mga anak nila because may work din. So what is the possible solution for this?
Oh, sorry. I was muted pala. So I was saying, yung hindi mo talaga sila mababantayan. So, siguro one way is to, yung tracking mo sa telepono. Di ba merong ganun? If you share your family sa phone, there's such thing as you can track them. Second, you have to be open to communication. Kasi magtatago po sila pag hindi tayo open sa communication with them. Dapat malaman po natin more about nila. Wala naman hong masama na they date. Normal na po yun eh. Okay, so let them realize na it's okay. I don't mind, but at least you have to tell me, asan ka at this particular time, anong activities mo, and siguro sabihin na rin natin to wear protection. Siguro talagang kailangan na yun eh. It's a must. So, yun ang ko. That is my concept of how to guide them properly. And make monitor.
Yes, ma'am. Siguro, I think yung takeaway natin, yung cornerstone is openness ng kids natin to the parents. Kasi the more open they are to you, the less chances naman na meron silang gagawin kakaiba. Okay, so I'll pass the floor now to Dr. Shantas. Thank you.
Thank you.
So in the interest of time, you may send your other questions to ubi_residents@yahoo.com, and we will try our best to answer your questions promptly.
Okay. As our event today is coming to an end, we would like to award a certificate to our lecturer. And this certificate of appreciation is being awarded to Dr. Melinda Rita L. Javier for her invaluable contribution as speaker on the topic of adolescent pregnancy. Insights, challenges, and interventions held via Zoom this 31st of August 2024. Signed by Dr. Jennifer Aranza Mendez, Chairman of our department, Dr. Maria Teresa Trisha Bautista, OIC, Professional Education, Training and Research Office, and of course, Dr. Evelyn Reside, our Medical Center Chief, the Quirino Memorial Medical Center.
Reminding everyone that there is a link posted in the chat box for your attendance purposes. Please do not forget to enter the link for your attendance to be recorded. So this ends our EHQUIP lecture for today. We would like to thank everyone who participated in the lecture, most especially our lecturer, Dr. Melinda Rita L. Javier, and our moderator, Dr. Angeline Santos, for imparting their knowledge to all our participants. Thank you for the time you provided for this month's EHQUIP lecture. We hope to see you all again in the next EHQUIP. Have a good day. May we ask everyone to open their cameras for a photo op lang po. We have 5 panels for pictures. Let's start with the first one. 1, 2, 3, smile. Okay, next panel po. 1, 2, 3, smile. Okay, on to our third slide po. 1, 2, 3, smile. And then fourth po. 1, 2, 3, smile. And then for our last slide na po. 1, 2, 3, smile. Thank you to everyone who participated in today's EHQUIP lecture. We hope to see you again next time.
Thank you, everyone.